Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. The show is also sponsored by Zyga Healthcare Group, a leader in providing senior living, home healthcare, and hospice-related services throughout the entire DFW Metroplex. My name is Dr. Paul Cespedes. I'll be co-hosting today's show with Dr. Parin Makadia. I just want to take a quick second to talk a little bit about Hurricane Harvey down in Houston. Accent Podiatry Associates is raising funds to be donated to relief efforts in Houston due to Hurricane Harvey, and Dr. Bacta has agreed to personally match any funds that are donated. So make Dr. Bacta pay for this, and please donate money. You can check it out on our Facebook page, doctalklive.com. We have a link there for it. If you can't donate money, please consider donating blood. There's always a need. You can check your local blood bank for that. And with that, here's Dr. Makadia.
Hello folks, this is Dr. Makadia, your co-host of Doc Talk Live. Today, ladies and gentlemen, we have a great show for you all, and the topic is definitely one that needs to be stressed and one that we have discussed several times on our show, and also a topic that many of us can relate to. Now, heart disease is the leading cause of death in the United States. People of all ages and backgrounds can get this particular condition, which, if you ask me, is very alarming. Think about it, anyone and of any age. That's why today we will be discussing preventative cardiology, and we have Dr. Robert Liao in the studio with us. To be part of the conversation, please call us at 972-235-5555. Again, that number is 972-235-5555, and we will be happy to take your questions live throughout the show. Dr. Liao, welcome to Doc Talk Live, and thank you very much for volunteering your time to be part of our show. Please tell our listeners a little bit about yourself.
Dr. Makadia and Dr. Cespedes, thank you so much for inviting me to the show. I am a cardiologist in private practice. I've been practicing about 14 years. We mainly practice at Medical City. We also go to the Heart Hospital in Plano. I practice in general cardiology as well as interventional cardiology, which is the plumbing aspects of cardiology that people hear a lot about. I have interests in preventive cardiology, and it also ties into some of my recreational interests with running, marathons, and ultramarathons.
Oh, wow. Ultramarathons, huh? Wow. All right. Thanks again for coming. We're really glad you could make it today. Heart disease is the leading cause of death for both men and women. What exactly is preventative cardiology, and what are some of the signs and symptoms of heart disease?
So, preventive cardiology is a loosely defined field within cardiology, looking at ways that we can reduce cardiac events such as heart attacks, heart failure, and strokes by focusing on risk factor reduction and emphasizing lifestyle modification, and really trying to prevent the event before it even happens, rather than letting a heart attack happen and then chasing things down after the fact. So there's a very large focus on improving lipids, controlling blood pressure, smoking cessation if that's appropriate. So I spend a lot of time on nutritional strategies, exercise recommendations, and then optimizing existing medical problems.
Great. Let's take a live call. Hi, welcome to Doc Talk Live. Go ahead with your question.
That's a great question. How old are you, by the way? Excellent. Thank you. Dr. Liao will answer your question.
Okay, so it sounds like you are being worked up for possible blockages in your heart. You've got a modestly elevated cholesterol. I suspect that your echocardiogram demonstrates what we call diastolic dysfunction, which just means that your heart is a little bit stiff. And then the key point was that you underwent a stress test to see if there were evidence of blocked arteries in your heart, and that was fine. And so if your symptoms are atypical, meaning that they're not what the doctor thinks is likely to be due to blocked arteries, and your screening test, which was the stress test, is okay, I agree with the care that you're getting, and that a coronary CT angiogram is probably not necessary and might incur extra risk.
All right, let's take another call. Hi, welcome to Doc Talk Live. Go ahead with your question. All right, thank you.
Okay, that's a great question. So the question is about what we call an atrial septal defect, and that is a hole in the top chamber of the heart. It is the most common congenital heart defect, and we frequently actually see it in adults because people can be completely healthy and make it to adulthood without any problems. The decision about whether an ASD needs to be closed is driven by a number of factors, largely symptoms, and then there are some findings on the echocardiogram which would lead the cardiologist to recommend closure. It sounds from what you've described that you have a relatively small ASD that probably does not need to be closed, just needs to be followed, and there are some very specific things that we followed with the echo. So I think you're probably on the right track.
All right, let's take another live call. Hi, thanks for calling Doc Talk Live. Go ahead with your question.
Excellent. So the question was, he has a heart condition where he's given metoprolol, and he's having leg pains from it. So wanted to know if the medication itself is causing the pain itself. So perhaps you want to talk about the side effect of metoprolol, or if he's having pain in legs, what are the common cardiac medications implicated in such a thing?
This is Dr. Liao again. Leg pains from metoprolol are generally not common. It is theoretically possible if somebody has very severe peripheral vascular disease to have that. Some of the other common cardiac medications that might be causing leg pains would include statins, which are given for cholesterol.
All right, let's take another call. Hi, welcome to Doc Talk. Go ahead with your question. Okay, that's a good question. How old are you? 34. All right, thank you.
Okay, this is Dr. Liao again. Thank you for the question. That certainly can be true. I think the things that would drive the decision about whether further testing is appropriate would depend on your other risk factors. For example, if somebody was very high risk, say smoking and had diabetes, then I would encourage more testing. But there are certainly people out there walking around who have abnormal baseline EKGs, and it is not related to any sort of the current cardiac complaints.
All right, let's take another question. Hi, welcome to Doc Talk. Go ahead with your question.
Thank you for your question.
Hi, thanks. Dr. Liao again here. The one problem that we have had with fitness monitors is that they are sometimes inaccurate, and I had this in my own experience. I had a Apple Watch and I had a variety of different fitness monitors, and there was a recent lawsuit involving one of the, I think it was Fitbit, being used as a medical device. Now, if you found this monitor to be generally accurate on yourself and you're at rest, then it's probably accurate, and you probably should talk to your primary care doctor or cardiologist. But just be aware that these things are not medical devices and subject to a lot of noise.
Excellent. Folks who just joined us, you're listening to Doc Talk Live, and we have Dr. Liao in the studio. We're discussing preventative cardiology. The number to the studio is 972-235-5555. Dr. Liao, can you tell us what are the risk factors of heart disease and what heart screening tests should be done on a regular basis?
So the classical risk factors include hypertension or high blood pressure, abnormalities in cholesterol, which is high bad cholesterol or low good cholesterol, diabetes or even pre-diabetes, and tobacco use, male gender as well. And the screening test is a complicated question, but in general cardiology, there is not a single good screening test, say like in kidney function, where you can screen with a blood test called creatinine. So the best screening test is a careful history in cardiology.
Okay, let's see, we got about 30 seconds left. When we come back from the break, we're going to talk a little bit more about some of the therapies for heart disease. We'll keep taking phone calls during the break. We're in the studio talking to Dr. Liao about preventative cardiology. To ask your questions, please call us at 972-235-5555. Again, the number is 972-235-5555 to talk about cardiology with Dr. Liao.